Wilson disease is a rare genetic disorder of copper metabolism. Copper is a metal, but the body also needs it to function normally. And in Wilson disease, it affects patients, only about 1 in 20,000, where they inherit 2 faulty copies of a gene. This gene is called ATP7B, and normally it works to do 2 things. It helps the liver to get rid of copper into the gut, and it also then helps create a protein which then allows the copper to travel around the body. When you have 2 faulty copies of ATP7B, you can't get rid of the copper from the liver, so it stays in the liver, and that eventually causes inflammation, scarring, and can lead to liver failure. And because you can't package copper and transport it around the body, you have a rise in the amount of free copper, unbound copper in the blood, and that can then travel and affect other organs, most importantly the brain. So untreated Wilson disease is a lethal condition where patients get eventually liver failure, and they get movement disorders and progressive deterioration of their neurological status. Thankfully, we've got very effective treatments for Wilson disease that either work in one of 2 ways. Either they're called chelators, where you bind up the copper for it to be excreted through the urine, or you try and block the uptake from the gut. Now, whilst lots of clinicians and centres are very experienced in using these drugs, there's no well-defined universal treatment protocol. And treatment studies show that if you are effective at getting rid of copper, then the long-term prognosis for Wilson disease is excellent. However, some of these drugs have got side effects. So an important balance that we need to strike is managing the amount of copper in the body so that patients have the minimal effects from their Wilson disease, whilst also minimizing the side effects of these drugs.